Hi guys, welcome again to the Doctor Show. Today we are going to talk about a new subject, so interesting subject for me and for all the women, even men. Everybody is really curious about their beauty. So today we are going to talk about when is the time that you should see a specialist, a plastic surgeon, a cosmetic doctor that you can help you to look more beautiful. Why do we have wrinkles? Why they perform? What can we do to avoid having the aging process? How can we stop ourselves from aging? So we have a lot of questions. These questions are going to be all discussed today. So please stay tuned. I have a lot to tell you. So we have our special guest, Dr. Ismail. He's going to talk more details about our today's subject. So I will let him to introduce himself. Welcome, Dr. Ismail. So if you please can introduce yourself to the audience.
Thank you. By the way, I'm Dr. Ismail. I'm a plastic surgeon and a laser surgeon. I'm glad to meet you and you here to discuss about the procedures we are doing about the facial rejuvenation.
It's our pleasure, doctor. So it's a really big topic. I don't know where to start about, but you know, it's like nowadays everybody's concerned about their beauty and the way they look. So if we just can start, what age is the most suitable age for a girl or for a man as well? Because the beauty is not just for the women. So when shall we start seeing it? Where the aging process and what age should start? Where should we stop? We start taking care of our skin.
Okay.
You know, there are a lot of external environments, external factors that can really damage the skin. So when do we start taking the daily routine?
Actually, first of all, we have to know why the people seeking about the facial rejuvenation or any other cosmetic procedures. The first factor, the first thing is to know about the aging process.
Yeah.
As we know that any people or any person seeking the facial rejuvenation or any aesthetics procedures because of the appearance.
Yeah.
And this is because of the aging process. When the patient is aging, the face will sagging down, including the skin, the pigmentation, wrinkles, and you know, the ligaments, mass will sagging down and start to lose the volume as well. And also we have many different factors for the aging process, the appearance, people looking more aged than their age.
Is there anything we can do, like the lifestyle, the food, the diet that we can take is just going to stop this aging process?
You know, we have many factors, as I mentioned. The first one is aging. Yeah,
the
as
aging
we know, the aging
itself.
process itself. Yeah. The sunshine that the people exposure to the sun is the second factor, and environmental factor as well. The lifestyle of the persons, and you know,
genetic reasons.
The genetic reasons as well.
So you recommend that everybody should wear a sunscreen, especially in our area.
It's mandatory to wear a sunscreen 360 times per year. It means every single day. Every single day you have to put sunscreen to protect your skin of wrinkles and pigmentation.
So if we have already developed wrinkles, it means now we have to do an action right now. Once we figure out that we start to have wrinkles, or we just can let it go for a while, and then so what do you recommend? Once you see wrinkles, we have to get involved. We have to see a doctor, or when it goes more
when
further?
We talk about the aging process, we have to look about the age, which age it's recommended to see a doctor or do some procedures.
Yeah.
We don't recommend any person below 25 years to do these simple procedures. As we know, after 25 years and up, the wrinkles start to appear. It's fine lines, maybe pigmentations, maybe or medium to deep wrinkles. So up to 25 years old, you can start, for example, non-invasive procedures like Botox, some fillering for restoring volume or for filling the lips, or some other procedures like lasers for resurfacing or for pigmentation.
So the Botox and fillers, it's just going viral. Everybody's just keep on thinking about it. So if we want to define what is it, what is Botox, what is filler, what is it biologically acceptable? Does it have any side effects? What are the instructions that we should give to the patient before or after taking these kind of treatments?
Yeah, Botox, it's botulinum toxin. So it is a toxin of a bacteria that
so
produces
extracted
from a bacteria. It's previously used for treatment of some diseases, and it's approved to paralyze the muscles. In cosmetic medicine, we are using for decreasing the wrinkles around the eye.
The forehead?
Yeah, the forehead, inside the brow, the frown wrinkles, and the crow's feet. Yeah. Actually, it doesn't have any serious side effects. Any patient can use every 6 months to reduce the wrinkles. Regarding the fillers,
any contraindications? Some people, they are not recommended to take.
There's some contraindications. For example, if the patient have Graves' disease like muscle weakness is contraindicated. In pregnancy, it's contraindicated, and there's no any other contraindication. Or if the patient have allergy to the Botox, it's contraindicated.
Okay. What about fillers?
Filler is hyaluronic acid. We have different type of fillers. Previously, we have had the permanent filler.
Silicone.
Actually, not silicone. Silicone is not a filler. It's a different kind of implanting, you know. Yeah. But regarding the filler, we have different type of fillers like collagen, like permanent fillers that previously used for restoring the volume. But now it's prohibited, and it's not using anymore because it may get different complications.
So the hyaluronic acid is
a new generation of fillering that it's temporary. It take about 8 months to 1 year. It will use for restoring the volume. For example, in the nasolabial fold, for cheek, for lips, for around the eye.
So they are biologically acceptable. They don't have any.
Yeah, it is very acceptable because it's hyaluronic acid. It's already present in the body and in the skin. We are using for restoring the body, but it's mandatory to use by a professional, doctors to
the problem is now here some salons, non-medical people, they're just using it. They think it's easy, but the complications are serious.
Actually, it is not easy like this that we see the market. It's not. Even the companies and the textbooks are prescribed that it should be used by the professional doctors.
So even not even any doctor, a well-trained doctor.
It's mandatory to be used by a skilled hand and the well-trained doctors.
Another problem that people, especially women, keep on asking about, it happens more in women than men, which is the panda eyes. They have dark circles under their eyes. So why this happens, and is there any treatment for this?
The dark circle, it has many factors that may happen. There's some treatment we are using. If the patient is above the 35 years old, we usually do the blepharoplasty, restoring the volume under eye, and also the upper blepharoplasty. Below the 35, we are using the mesotherapy, PRP, platelet-rich plasma. Nowadays, it's used for rejuvenation of this area.
So PRP basically is like we just withdraw blood of the patient.
Yeah, we're going to draw the blood, and we separate the platelet-rich plasma
which is one of the
specialized centrifuge, and then we're going to inject in the whole face or under the eye. Yes.
So do we add any vitamins to the PRP, or just
sometimes we add some vitamins like vitamin C or glutathione. It's it boosts the rejuvenation of the area.
So we still have a lot of treatments for that. Now, what about if the Botox? So you said the wrinkles is just for the head and around the eye area. What about if we have wrinkles or sagging in the lower part of the face, the lower face? So in these cases, Botox are not going to do any benefits. So what's the option that we have?
This is accordingly. If the patient has more sagging, for example, up to 45 years and up, we're going to do the face lifting and neck lifting, and at the same time you can do fillering or autologous fat transfer. You know, we're going to take the fat from
their own body,
and then transfer to the to restore the volume. For example, the mid cheek, you know, the nasolabial fold and under eye.
So is it like under local anesthesia this happens inside the clinic, or it has to
the
be?
autologous fat transfer we can do under local anesthesia. We're going to anesthetize the area, for example, lower abs or inner thigh, and then we're going to take the fat and we will prepare the fat like filler, and then we're going to inject.
Any side effects?
Of course, any
bruising.
Any procedure in the medicine has some traumatic or some complications. It has some bruising, swelling, and it will settle down after 1 week, 1 to 10 days, and then it will rejuvenate the area because the fat transfer, cells, it contains the stem cells that will rejuvenate the area.
So there's a stem cells within the fat.
Within the fat there's some stem cells. With the autologous fat transfers, it's not separated, the pure stem cell.
So they stimulate the collagen and elastin.
It will boost the producing collagen and restoring volume, and as well as rejuvenate the area from down to up to the skin.
Basically, if I compare the hyaluronic acid to the fat,
I prefer fat.
Fat.
Yeah, of course.
Yeah, and which was more expensive procedure?
It depends according to the case.
How much fat they requires?
Different between patient to patient, and we cannot decide. It depends.
But the fat is more acceptable.
It's more acceptable, and it is last longer, and also it's much more natural.
Yeah. So there's no still even hyaluronic acid is still so biologically acceptable, but somebody's his own cells is just going to last for longer.
Of course, fat is preferable over the hyaluronic acid.
So the facelifting, if you can talk more about the facelifting, so what, if you can just define it, what are the types? Because there's the thread lifting, there's surgical lifting, so what is the difference? Which one's going to last longer?
It depends according to the patient. When we examine the patient, accordingly, we see that the face is sagging, especially the jawls.
The jawlines.
Sagging the jawlines, the nasolabial folds, and also the cheek will sagging down.
Zygomatic,
it's with aging process, the ligaments and the mass layer will lose their tone, and it will lose down. So according to the patient, we're going to do the face lifting and neck lifting. Sometimes need
here,
especially in the
there's
very
fat
heavy necks.
Accumulation in here. I don't know why. Like a lot of women, they have fat in here. It just becomes just like
when the person is aged, some area of the face the fat will lose, and some area will collect the fat. Especially the submental.
According to the gravity,
according to the gravity.
So
and under eye, the teardrop deformity, the nasolabial fold, the jowls will sagging down, and these area will lose their fat, the volume,
and liposuction and facelifting.
We can combine the facelifting at the same time the autologous fat transfer to restore the volume that the patient lost.
And the thread lifting?
Actually, the thread lifting is not recommended by the plastic surgeons, but it's a new trend for rejuvenation of this. It's approved, and for patients below 35 years need some rejuvenation, non-invasive. The patient refused to do the surgical procedures.
Exactly.
We can do some thread lifting.
So if I compare the thread lifting to the surgical, so of course the surgical involvement way better in compared to the result. last longer, maybe. Thread, it's there, it's approved, but according to the patient needs, if they're too scared to get surgical treatment, so thread lift is a good option.
You know, personally, to be honest, I prefer the surgical lifting for patients above 45 years because it's a long-lasting, you know, results, and we can see the dramatic result, and it's much more natural. But it is need the general anesthesia and the downtime. It's much more
general
than
anesthesia.
General
so how long
anesthesia.
does it take for the face?
It's about 3 to 3 hours. It takes 3 to 4 hours.
But the whole face.
The whole face and the neck lift. You know, we're gonna open the
incisions.
The incision in sideburn here and behind the ear. We're gonna lift the smash. You know, we're gonna tie the smash and then we redrap the skin. And
so the incision is not going to show after that. It's not going to leave a scar.
It's a fine line scar.
Fine line scar.
Yeah.
So it's not
just here in the pre-tragal or inside the tragal. It's a fine line scar.
So another topic that still like a lot of people ask about, which is the nose job or the rhinoplasty. So we hear like some people they're just getting their nose fixed by using fillers and hyaluronic acid. What kind of patients that we can apply this procedure on them, and which one doesn't work for them?
Yeah, regarding the rhinoplasty, we are doing rhinoplasty because of two reasons.
Yeah.
One is the functioning, and the second one is the aesthetic and appearance. You know, and we can combine the functional rhinoplasty with the aesthetic appearance. You know, the septal rhinoplasty. Because some patients have septal deviation. We're gonna correct the septum, and you know, at the same time we do.
So what is like if someone has septum deviation, what they are going to go through?
It's better to do the septal rhinoplasty, the septal fixation, and
what
you
do
know.
They feel? So if someone they have a
difficulty in breathing.
Difficulty in breathing.
Yeah, they have difficulty in breathing, and you know, nasal speech, and sometimes epistaxis. Yeah, exactly.
I mean, I'm a good patient.
Yes.
Yeah, good candidate.
And you know, sometimes the epistaxis because of the septal deviation. We're gonna correct the septum, and at the same time we do the rhinoplasty. You know, the aesthetic appearance.
Aesthetic appearance. So when I say this patient really requires rhinoplasty, just because of the size, or they think like according to the medical measurements they're okay, but they're not satisfied about the way they look. So what kind of?
We have the facial proportions. You know, we're gonna examine the patient and do the measurements of the nose according to the face. You know, sometimes patient come to me and ask seeking for rhinoplasty, and when I measure her nose, the harmony with the face, I'm telling them you don't need to do rhinoplasty.
They're all match.
Yeah, of course, but sometimes long nose, and the patient have, for example, a breach in the dorsum, sometimes deviation. You know, we're gonna do the rhinoplasty at the same time for septoplasty, and sometimes just seeking the patient for just aesthetic appearance.
Yeah.
They don't have any problem in breathing. Just doing this rhinoplasty.
Rhinoplasty.
Yes.
So, for how long does this kind of surgeries takes, and what are the contraindications for the people who cannot do, even if they need, but they cannot do it?
Basically, the rhinoplasty needs the general anesthesia. It takes about 2 hours, 2 to 3 hours, accordingly. You know, and there's some contraindication for doing the rhinoplasty. For example, if the patient have allergy to the drugs that using in the general anesthesia, or you know, there's no absolute contraindication for doing the septal rhinoplasty, but there's some borderline. You know, for example, in pregnancy we can.
Of course.
It's contraindicated.
Diabetes.
Diabetes is not an absolute contraindication.
It can be controlled.
It
if
can
the
be,
glucose level
it
is
should be
really-
controlled, and then we can do the septal rhinoplasty.
Then the instructions that you follow up instructions that you
The
give to
instruction it
patients-
take, we're gonna apply the plast, internal the silicone sometimes, and the plast.
inside.
Yeah, inside and external plast for about 10 days, 7 days to 10 days, and then we remove everything, and that's it.
So they should expect like drainage and nasal discharge, bruising, pain. So if we just can describe the pain.
Yeah, of course, it will swollen and bruise, ecchymosis for about 1 to 2 weeks, and then it will go.
And the plast that you're going to apply, they have to remove it after 10 days?
After 10 days, yes.
And then when they can start, for example, if someone is working out, when they can go
the
back
patient can go to
Daily
go to
routine.
daily routine, but some restrictions, for example, exercise, the eyeglass for about 6 weeks.
6 weeks?
Yeah, 6 weeks eyeglass, 6 weeks, and the other daily routine after
Has
10
to be
days.
removed.
Yeah.
So do they have to sleep in a special position? They have to lift up their heads? Because we hear like there are some...
Need to be the head up and in a supine position, 30-degree head up, and not to sleep on the nose, on their nose.
Oh, for how many days? Until the plast is removed?
No, it's mandatory to not sleep on their nose, on their face, up to 8 weeks.
8 weeks,
Yeah.
which is 2 months.
Yeah, because we're gonna do the osteotomy, and the osteotomy need to be healed.
So what's the osteotomy?
Completely
Because I do
osteotomy.
understand what
We have nasal bones,
bones,
to correct the nasal bones, and the side walls to be narrow, and the ascetic dorsal lines. We're gonna fracture the nasal bones and
so break parts of the bones and then we reattach.
It's a green stick fracture, not completely, and it take 8 weeks to be healed completely.
And the cartilage as well.
And the cartilage, it's accordingly depend
case.
on the case,
Depends on
and
the
sometimes we're going to do the cartilage grafting. Sometimes we remove the cartilage accordingly.
So the cartilage grafting we're taking from somewhere else from the body?
No, from the same patient. We're going to harvest from the septum. If there's a secondary rhinoplasty, is another issue. We're going to harvest the cartilage from the ear sometimes, or from the rib cartilage.
And then we have to insert it.
Yeah, we insert and we use for augmentation of the nose.
So
especially
that's
for the
procedures.
reconstruction of the secondary rhinoplasty, or sometimes fractured noses, or in Asian rhinoplasty as well.
So I think this is the most common surgeries that we are applying these days. Like everybody is just obsessed about getting a rhinoplasty and their nose job. So what about that, fixing the nose or changing the shape of the nose using fillers?
I'm not preferring using the fillers in nose because
or thread lifts. We see these things online a lot.
I'm not preferring to use the threads or fillering in nose, because nose is a very delicate organ, because it's included the skin, subcutaneous tissue, the mass, the cartilages, the bones, the pyramid, and ligaments. This is
a lot of details.
This cannot be corrected by the hyaluronic acid injection or some thread lifting. It should be corrected by a surgical procedure. Yeah.
Surgical. So they're basically it's useless. It's all gonna go away, and it's
not
going
just
to give you.
It just waste time and money.
Thank you a lot, doctor. That was really, really helpful for a lot of people who are watching. For myself, I got a lot of information from you. Thanks a lot for accepting our invitation to give in our show. Thanks again. So I wish we were beneficial today. That was still, just stay tuned. We have a lot to tell you. Thanks for watching. See you soon.